Hello dears, in this video you will learn about cholera, its causes, transmission, symptoms, treatment, and prevention. So let's get started. What is cholera? Cholera is an acute diarrheal illness, which is caused by infection of the intestine, with the bacterium Vibrio cholerae. It is primarily spread through contaminated water or food, and can lead to severe dehydration and death if untreated. What is the cause of cholera? Cholera is caused by infection with the bacterium Vibrio cholerae. However, the disease spreads and becomes dangerous due to specific conditions related to the bacteria, human behavior, and environmental factors. Primary cause: Vibrio cholerae bacteria. The main pathogenic strains are O1 and O139, which produce the cholera toxin, CTX. This toxin triggers severe watery diarrhea by disrupting ion transport in the intestines, leading to rapid fluid loss. How does cholera spread? Cholera is not directly transmitted from person to person but spreads through the following. Contaminated water. Drinking or using water contaminated with feces from an infected person. Common in areas with poor sewage treatment or after floods. Contaminated food. Eating raw or undercooked seafood, especially shellfish. Fruits and vegetables washed with contaminated water. Street food prepared in unhygienic conditions. Poor sanitation and hygiene. Open defecation near water sources. Lack of handwashing after using the toilet. Risk factors for cholera outbreaks, which are natural disasters, floods, earthquakes that disrupt clean water supplies. Overcrowded living conditions, such that refugee camps, slums. War or conflict, leading to breakdown of sanitation systems. Warm climates. Vibrio bacteria thrive in brackish water. Diagnosis of cholera. Cholera is diagnosed through a combination of clinical evaluation, symptoms and history, and laboratory testing to confirm Vibrio cholerae infection. Rapid diagnosis is crucial to prevent severe dehydration and control outbreaks. Clinical diagnosis, initial suspicion. These are symptoms: profuse, watery diarrhea, rice water stools. Vomiting. Rapid dehydration. Sunken eyes, dry mouth, low blood pressure, weak pulse. Muscle cramps, due to electrolyte loss. Epidemiological clues. Recent travel to or residence in a cholera endemic area. Consumption of contaminated water or food, example, raw seafood. Outbreak setting, disasters, refugee camps. Point to be note: mild cases may resemble other diarrheal diseases, for example, etc., rotavirus. Severe dehydration with no fever suggests cholera. Second is laboratory confirmation. Stool sample testing. Gold standard. Microscopy, dark field or phase contrast. Shows motile Vibrio cholerae, darting movement. Stool culture. On selective media, example TCBS agar, yellow colonies confirm Vibrio cholerae. Rapid diagnostic tests, RDTS. Dipstick tests detect cholera toxin or Vibrio cholerae O1 or O139 antigens. Results in 15 to 30 minutes. Useful in outbreak settings but may need culture confirmation. Polymerase chain reaction (PCR). Detects Vibrio cholerae DNA, highly accurate but requires lab equipment. Serological testing. It is less common. Detects antibodies against Vibrio cholerae. It is useful for research, not acute diagnosis. Antibiotic sensitivity testing. It guides treatment. Some strains are resistant to tetracyclines or fluoroquinolones. Differential diagnosis. Cholera can mimic other causes of acute watery diarrhea, such as enterotoxigenic E. coli, etc., rotavirus in children, norovirus, salmonella or shigella infections, often with fever and bloody stools. Treatment of cholera. These are oral rehydration solution, ORS, is used to replace lost fluids and electrolytes. Intravenous, IV, fluids. In severe cases. Antibiotics, example, doxycycline, azithromycin, to reduce duration and severity. Zinc supplements, for children, to reduce diarrhea duration. Prevention of cholera. Safe drinking water, boiling, chlorination, or filtration. Proper sanitation. Avoiding open defecation. Hand washing with soap. Oral cholera vaccines, example, Decoral, Chanchol, Ervichol, for at-risk populations. Avoiding raw or undercooked seafood in endemic areas. That's all about cholera. Hope you understand well. Kindly like and subscribe for more.